All right, we're gonna go ahead and wait a few minutes. Let me know if you can hear me. All right, can you all hear me? Hey everybody. Yeah, I'm gonna wait a few minutes just to see who else joins. Hey everybody. Thank you for joining. I'm gonna wait one more minute and we'll go ahead and get started. All right, so I'm gonna go ahead and get started. So my name is Daniel Diaz and I work with Behavioral Health Solutions. I am a prevention specialist. So some of you are already familiar with what we do with Behavioral Solutions. Some of you may not be familiar with what we do, but we are a nonprofit organization and we deal with research, prevention, treatment, and recovery, dealing with substance use. And when I say substance use, I mean drug use. So we like to use the term substance use because there's a stigma with drug use. Once you hear the term drug use, people tend to think, oh yeah, they're a bad person or they're a druggie, which is not the case at all times. So we try to use the term substance use. So I'm gonna explain a little bit what a prevention specialist does. As a prevention specialist, I do presentations, activities, and programs within the schools and communities to provide information regarding substance use or information on facts about drugs. So a lot of times we get information or we get requests for providing information on different types of drugs that are out there. It can be something from tobacco, alcohol, marijuana, to maybe some drugs that others may consider hardcore drugs like cocaine, synthetic marijuana, heroin, meth. So us as prevention specialists, we can provide presentations, information, facts about how it can affect you academically, professionally, personally, and how you can avoid that kind of stuff or those negative choices in life. So today I do want to talk about National Prevention Week, but before I go into National Prevention Week, I want to talk about risk and protective factors. And the reason I want to talk about risk and protective factors is because they are very important in dealing with National Prevention Week. They go hand in hand. And if you're not sure what a protective factor is and a risk factor is, I'm going to explain right now. So a risk factor is any type of thing that can affect you adversely and to making incorrect choices or negative choices in life. So that can be from drug use, truancy, your academic performance, either not doing well, hanging out with the wrong crowd, not having family support. And these risk factors, they're going to vary from age group to age group. So elementary and middle school, high school, adults, the elderly, they're all going to have different risk factors. Some may overlap, but they vary from age group. So for example, for youth, not having a positive outlet, not having an environment where you can go and let off some stress, that can be a risk factor, right? Because everything tends to build up. So protective factors are things that help you stay away from negative choices or help you make better choices in life. So protective factors can be having family support, being involved in your school, having some type of hobby or skill that can help you either have better life skills or make better choices in the future. And that's partly what our activity section that we do with schools, the community. We do activities that helps try to incorporate those life skills, try to incorporate hobbies or things that they can turn to instead of making negative choices. So sometimes those negative factors or those risk factors can actually be drug use. It's not always going to be those risk factors leading to drug use, but it can actually be drug use as a risk factor. And we know that with the risk factors, that can affect you. It's like a snowball. So if you know how a snowball is made, you pack some snow together. I know we don't really get snow here in the valley, but you pack the snow together, you roll a snowball together, and eventually it's going to be picking up more snow until it creates a bigger ball or bigger area. So just like with snowball, risk factors can increase your chances of having all those negative effects or negative consequences, negative choices. And thank you for everybody else that just joined. I just saw right now. So I wanted to talk a little bit about that before I went into National Prevention Week. National Prevention Week is actually a really important day for us in the prevention field because it helps us provide more resources to the community, provide more things that the community can use. So for National Prevention Week, some of you might not know what National Prevention Week is. Those of us in the prevention field who work closely with the schools or SAMHSA, who are the ones who promote and sponsor this event. For those of you that don't know who SAMHSA is the Substance Abuse and Mental Health Services Administration. But every May, this is a yearly thing, annual, we have National Prevention Week. Usually it falls somewhere in May. This year it falls from the 10th to the 16th. So for National Prevention Week, it's a week that we use to increase awareness on different substances that are out there. We try to provide presentations, activities, programs in the schools to bigger things, which I'll talk about a little bit, and the way that we're adapting due to COVID. because usually with these events, we're in the schools, we're doing presentations, we're doing activities with the kids, we're there in person, being able to provide these resources, these skills, these life lessons. But this year, we have to incorporate a lot of virtual things. So virtual presentations, virtual activities, virtual information. So again, SAMHSA sponsored this event, and it happens every year, and usually there's a theme for every day of the week. So it started yesterday. Yesterday, Monday, May 11th, was preventing prescription drug and opioid misuse. So we have pamphlets, we provide information and presentations, and as we know, prescription drugs, opioids are a big problem right now. I know it's been a lot of these prevention efforts, a lot of these substance use efforts have been overshadowed by COVID-19, but that doesn't mean that substance use or drug use isn't going to be a problem anymore, or it's not a problem anymore. It's still currently a problem, and maybe even more so due to all the stressors that the COVID has brought with us. I know there's people that have lost their jobs, there's people that have just been bored, they didn't have any extracurricular activities, any outlets to let go of their stress or do some self-care or be able to not have that extra stress in their life. And that's part of the reason we do these videos. We have different videos dealing with stress management, mindfulness, information on all these substances that are out there. So those that actually need the help, or those who need more awareness, can have these as an outlet. So yes, for sure, I'm not going to go too much into each of the topics for each day, because we're going to be able to provide information for each of those days throughout the week, or virtual information, or other Facebook Live things like this. But I'm going to briefly talk about them just because they're the themes of that day. So we do know prescription drugs, opioids are a big problem. And we do try to provide awareness and information on like drop boxes, which you can find all this information on our Facebook, our Instagram, and our YouTube. So today's theme for May 12th is preventing underage drinking and alcohol misuse. So for alcohol misuse, underage drinking, we also know that's a really big problem. And before everything happened, before COVID and the shelter at home, there was always car accidents, maybe people dying because of DUIs or DWIs while driving while intoxicated. And I guess you can always try to look at the positive in everything, because everybody was in shelter at home. People were not supposed to be going out. I haven't heard as much accidents. Of course, there were still people that were still going out and doing things they weren't supposed to, but underage drinking is a big problem, and we try to prevent it from elementary, middle school, high school, to the point where it ever becomes a problem or threatens somebody's life. So underage drinking is today's theme, and this one, it's really big with kids. We try to provide information on facts. We don't tell them, don't do this, don't do that, because obviously, you know, with youth, they tend to do the opposite of what you tell them to do, or just because it's an authority figure telling them, they might do the opposite. So we try to get them with facts, just provide information about the stats, how it can affect them personally, academically. And every once in a while, we incorporate activities like the drunken goggles. This one's actually really fun. I was gonna do a live demonstration, but I don't want you all to see me doing this. But this is something that we incorporate with the kids so they can have an idea of how it is to be under the influence, and how hard it is to be doing simple tasks that could actually affect them and prevent them from reaching their goals in the future, or just living, you know. So Wednesday, tomorrow, May 13th, is preventing illicit drug use and youth marijuana use. So we know marijuana is a big problem here in South Texas. It's probably the most illicitly used drug here in the U.S. For us here in the valley, we have a unique culture because we're right next to the border. So people are able to get things, but this one we're getting a lot of controversy because it's illegal some places, illegal some places. You're gonna hear people say it's good for you. If it was bad for you, then why is it a plant, or why is it legal some places? So even with this one, we do have to provide facts to the kids and let them know how it can affect them in the long run, not just their health or their body, but the way they develop, their choices they make, and how it could lead to making other bad choices. So no, we know marijuana is a drug, it's not safe, but kids still need information. We still need to provide this stuff for them. So Thursday, May 14th is preventing youth tobacco use, and now it's more with e-cigarettes and vapes. So we know e-cigarettes and vapes are really popular. We started getting more information on it. We started getting more consequences associated with vaping and e-cigarettes, but with kids, they're gonna still think it's really popular. They're gonna think that it's safer if they don't have our information. If they don't have us doing our prevention efforts, it'll become the new norm. It'll become something that they continue to do along the way, or the biggest trend, which we saw it blow up last year and this year. So we know there's risk associated with this. We know that there's superfine particles that can still go into the air, other people can inhale. We know that they explode into people's faces, and they've caused either breaking people's jaws, causing death, comas, the liquids filling up people's lungs. So there's a lot of things associated that kids don't know, even adults don't know about these things, and that's why we provide these services to them as well. And like I mentioned, we do like to target youth because we are prevention. We want to prevent them from ever going to that, but there's adults who can benefit from our prevention efforts as well. So we just continue to provide this information for everybody in the community. So Friday, May 15th, the last day of National Prevention Week, is preventing suicide. So substance use, suicide, they go hand in hand. I think now more than ever, we need to provide information regarding suicide, preventing suicide, better coping mechanisms, because you can't just take out one variable, or you can't just target one variable such as suicide, because everything's overlapping. Substance use, depression, mental health issues, mindfulness, self-care, all these things go hand in hand. And that's why we have to target all these different topics, all these different factors, risk factors that can contribute to bad choices or possibly suicide attempts. So we do try to provide this information during National Prevention Week as well. So we do have the suicide prevention lifeline that anybody can always call. There's also the number you can text, which maybe we can put down in the group chat or the comment section. But these are the themes for the week. And like I mentioned earlier, we did have to change things this year, because usually we're out doing presentations at the schools, we're doing our curriculum programs, we're providing information through table setups, information dissemination. And our curriculum programs too, we get to meet with our same kids, and we get to provide them a little bit extra information regarding all these different topics. Which I'll go into some of the things that we have done in the past, and the way we're kind of targeting or implementing this go around for National Prevention Week. I'm gonna check the comment section, just because it's harder for me to see when I'm talking. I get into the zone. Yeah, so usually when behavioral health solution has prevention specialists, we go out providing presentations or activities for those specific topics throughout the day. But this year it's a little different. All our efforts have gone to virtual presentations, or virtual information, or virtual resources for our community sites. So sometimes we would provide table setups, information dissemination, where we would set up a booth, and we would have the kids pledge for National Prevention Week. So National Prevention Week, they has a prevention challenge. So if you're not aware, there is a website. I don't know if it's been posted yet. So for National Prevention Week, you can go to this website. You can get these. You can print out these pledges or find out how you can participate or go into this prevention challenge. So I know there's also a delay on the computer and with me talking, so some of your messages I might not see right away. But this is the Prevention Happens Here challenge. So this flyer, usually what I've done is I would create a banner at the schools and I would have the kids do either the challenge hashtag, and then they would do this picture and they would post it on their social media, either on Instagram, Facebook, Twitter, wherever they could, and then they would use the hashtags Prevention Happens Here or hashtag NPW 2020. So I'm going to fill this out real quick so you guys can kind of see how it should come out. So on the top it says Prevention Happens Here, and you can either put your city, your state, your region, or your location. So for me, I'm going to put Hidalgo County because that's the county I serve. That's where my prevention efforts lie. And then on the bottom it says I'm preventing, and you can target a specific substance or just any drug use in general. But for me, I'm going to put alcohol specifically because today is underage drinking and alcohol misuse. So everybody that's watching or everybody that sees this video, I challenge you, I encourage you to create your own pledge, create your own picture, post it on social media. You can even hashtag BHS, which is our page. You can hashtag Prevention Happens Here. You can hashtag NPW 2020. And this one you can kind of show that you're proud, you're trying to create these prevention efforts. But like I mentioned before, since we do have to adapt to COVID, we do have to change things up. Before I would create a banner, have all the kids write, and then they would post it onto the big banner. So you would see a bunch of kids that had all these pledges, Prevention Happens Here, and it looked really nice. But this year, so what I'm trying to encourage through social media, through virtual means, that kids can pledge and provide these prevention efforts. Prevention Happens Here. So another one I want to talk about is this one. As me as a prevention specialist, I'm fighting the opioid crisis, and this one goes a little bit more in depth. I'm gonna read it out loud. I know you can probably see it, but I want you to hear it from me. So what I put is, I'm a prevention specialist. I'm helping fight the opioid crisis by informing the community on the purpose and proper use of prescription drugs and dangers that can stem from misuse. Knowledge gives power to the community. We are the first line of defense for many individuals in our community. We can make a difference in the lives of many. We are prevention. So everybody's going to be different. I've had contacts, teachers, counselors, coaches, boys and girls clubs do these same signs, but specific for what they're doing or how they're helping the prevention effort or the opioid crisis. So again, I encourage you all watching or your contacts or anybody in the community to be able to provide these on your social media using the same hashtags, hashtag NPW 2020, hashtag Prevention Happens Here. I'm trying to check the comments. So those are some of the prevention. We definitely had to change up some of our things. And one of the things I wanted to share that we're doing, one of my coworkers, Bianca, and United Youth Group are doing a virtual spirit week. So for each day, the days that I mentioned for the themes, they have their own themes but going with the theme of dressing or wearing things that through the Cinco de Mayo is like May 10th. And this flyer is on our Facebook page, so you don't have to worry about getting all the information here. So you can check on our Facebook page and get all this information as well. So I do encourage you to try to do these as well, because there's a theme for each day to dress accordingly. Like today's mono Chronomatic, which is wear a whole outfit, your favorite color. And for me, I'll show you, I'm wearing all black. So we just encourage you to participate, provide these prevention efforts through a fun way through your social media, because we know not everybody has the ability to print out the National Prevention Week stuff or ability to get some of these resources, so you can do it in your own way from your home. Because I know some people are still staying away from public events or the community, so this is a fun way to engage your community and provide a fun little theme that you can share on social media, like through Instagram, Facebook, and you can still use the same hashtags, but for us as well, you can use the hashtag BHS, or you can send a picture to Bianca, which is her email is on the flyer as well. Like I said, so for us, we're doing a lot of virtual stuff now. Before we would go to the schools and provide all these presentations, activities, table setups, booth setups. But now we have to incorporate a little bit and provide everything through either Facebook Live, YouTube, online webinar type thing, like where we can provide presentations to like a Zoom type thing called Adobe Connect. So if you still want some of these services or need some of these services, we can still provide these to you all in the community. So for sure, like if you need a presentation or activity, we can kind of tweak it and provide you something. So also I wanted to mention too, usually we would do like giveaways to thank the community, like either shaker cups, stress balls, so something so they can look back, and when they can remember, oh yeah, we had this presentation, this person came in and talked about all this stuff. It kind of gives them like a reflection or thinking about it again. So like this shaker cup we would provide to the community, and then they can probably think back about, oh yeah, this person or Mr. Diaz was talking about this substance, this drug. And we always put positive messages. So this one says, drugs make you weak, stay strong, and has our website on there. And these are really popular, you know, because kids like to be active and they like to stay fit. So these are pretty cool. Stress balls, you know, we would give these out to the community as well as thank yous or other incentives for participating in our prevention efforts. So this one is a smiley face emoji, and this one is a skunk. This one says tobacco stinks, and this one says eat drugs away. And this one, the pins light up. These are really popular as well. And so if you incorporate any of the things I was talking about today or any of the efforts on your social media, I'll find a way to give you some of these giveaways. Let me double check comments. Not yet. So that was a brief run through of the National Prevention Week. I could go into a whole Facebook Live, a whole presentation for each topic in itself, but I wanted to give you a brief run through especially for those who aren't aware about National Prevention Week. I know some people in our community, they're not aware of these days or these awareness or these prevention efforts that we do. So I wanted to bring to light some of the stuff we do. And just like with all these substances or these themes for these days, there is a protective factor called communication, which I like to incorporate. Having communication within your family, with your friends, helps as a protective factor, helps stay away from negative choices or drug use. So think about it this way. If you didn't have somebody to talk to, you might go to drug use to deal with your problem. And I know that seems like a big drastic shift, but some people do that. If they don't have anybody to talk to, they might go do drugs just because they want to get rid of their pain, their problems, their stress, or whatever's happening in their life. So I saw this. This was provided on the Westlake Chamber of Commerce's Facebook page, but it's an idea, activities for people to do. And some of these are a little more in depth, or some of these are super easy to do, like having a tea party. For me, I have 2 daughters. They would love for to do that, and that would increase protective factors. Or for some of my coworkers, some of my friends, I know they started baking, or they started cooking, learning how to make pizza from scratch, reading a book. So there's a lot of efforts on here that you can do to help increase the communication within your family, so you don't make those negative choices. But communication is very key, very important. And so I want to leave you all with something else too, like maybe you can think about or you can do on your own time. So this one is animal strength cards. And this can be something that you can use as an icebreaker to open the lines of communication within your family, with your friends. And you can kind of see what people would say about you or what they would think about you. So for this one, there's a bunch of different animals on here, with each with their own characteristic or trait. They're positive. They say your strengths. Let's see, I'm trying to focus it so you can kind of see. I know this is a little far. So for these, they all have something. You can ask other people. You can ask friends or family. Which of these characters is most like you? And of course, I can also provide this for you all, but this is a cool way to see how other people see you and what they think your strengths are. So this is a good way to see how maybe you don't see yourself having this strength or this characteristic, but other people might see you in this light. So this is a cool way to start the lines of communication. Maybe you don't know how to within your family or friends. Yeah, Jackie, Jennifer did learn how to make pasta. That's another one. Oh, sorry, I'm just barely getting to the comments. Yes, I'll make sure you all get giveaways. But yeah, going back to those characteristics, yeah, you can ask somebody, so what animal do they think you are? They might think you're like an owl, which is wise, or kind like an elephant, or gentle like a rabbit. So this is a cool way to do a little icebreaker, open the lines of communication within your family. And just like with anything that I do, I like to do things to help build rapport, communication, whether it's with my kids in the curriculum program, with presentations with adults or professionals, whether it's within my family. So the point I'm bringing up with this is this communication is this coincides with all the themes that I'm talking about. So we bring awareness for each of the drugs that are out there, but without communication as another protective factor, it can also lead to them going to those drugs or those bad choices. So just something else I wanted to leave you all with. So if you didn't know about National Prevention Week, you know a little bit more about it. You can get more info on the website provided. And I do encourage you all to do National Prevention Week, and if you can also do Bianca's and the youth group their challenge, that would be awesome. So you can reach out to us also if you want any presentations, activities, or any of our other prevention services. So thank you again. Make sure you like this video, subscribe to our YouTube, our Instagram, and our Facebook. Thank you.